Hello, we're here today with Kathryn Wessel, the CEO of the American Academy of Addiction Psychiatry and the principal investigator and co-project director for the Opioid Response Network. Thank you, Kathryn, for joining us today to share your successes around engaging judges and MOUD. Can you get us started by telling us about your role at the Academy and with the ORN?
Sure. Thank you so much for having me. I really appreciate it, Christina. As Christina mentioned, I am the Chief Executive Officer for the American Academy of Addiction Psychiatry, which is an academic society for psychiatrists who are board certified in addictions. And so their expertise is really looking at evidence-based practices around the prevention, treatment, and recovery of all substances in the prevalence of co-occurring mental disorders. And our overall mission is really about education and training. And so most of my members are connected in university settings. They're very involved in research and training, as well, obviously, as treating, but in the forefront of a lot of work in the evidence-based practice world. The way I got involved in the field has been through my earlier work, probably 15, 20 years ago, working at Brown University in the Center for Alcohol and Addiction Studies. I worked with one of the pioneers in the field of addiction, but really working with the medical community. And so at that point, I really was not involved in the justice system, and it was really about trying to get all primary care providers educated and trained on how to screen, diagnose, and treat or refer their patients for treating substance use disorder. And my mentor, Dr. David Lewis, really saw an opportunity because he felt that part of the challenge was the messenger. And there's so much stigma in this field that we really had to be mindful of that. So Dr. Lewis and myself and some others brought together leaders from the public health environment, not addiction specialists, but primary care folks in the public health arena, surgeon generals, secretaries of health, deans of the major medical schools, editors of all the medical journals, and formed a group called Physicians, Leadership in National Drug Policy. And the overall basis was to focus on what the evidence shows us about treating and preventing substance use disorders and how it compares to other chronic relapsing disorders. So the data shows you good outcome comes if you treat it much more effectively, like you do with diabetes, hypertension, and asthma. It became pretty clear soon on that you couldn't talk about substance use disorder without thinking about the legal consequences. And so after about a year of this project that was totally funded by private foundations, we decided to change it and to bring in leaders of law in with the leaders of medicine. And so the group changed from physician leadership on national drug policy to physicians and lawyers for national drug policy. Then we brought in the president of the National Judicial College, where they train all state judges, the Federal Judicial Center in Washington. We brought in deans of major law schools and scholars in the field of law. And together, it was really interesting to see law and medicine, who typically are seen at opposite ends of the scope of things, are believed to be that way, come together and really advocate for evidence-based treatment and prevention and treatment over incarceration. And that's not to say that people shouldn't be held accountable for their actions and if they go against the law, but we also know a large number of the people in the justice system have a substance use problem and they were not treating that medical issue. So it does overlap the two fields. And so that really was interesting to me, because how can we bridge that gap and cultivate law and medicine partnerships, a respect and an understanding of both systems, but also being able to be true to what our mission was. And fortunately, the physicians at that time, it was just physicians, and the judges like data. They need the data and the evidence. And so we were all focused on evidence-based practices, not to make judges to be experts, but to really understand the nuances and the challenges around these medical disorders. And so that's how I got involved with it. We developed a resource guide, and that was highly seen from the judicial system and educating judges. And so that happened, but unfortunately, society wasn't ready for that 15 years ago. They weren't quite as aware of how pervasive this disorder is. And particularly with the opioid crisis, it really became in the public eye, and everyone acknowledged finally that this is a huge public health and a public safety problem. So a few years ago, I was giving a presentation to some chief judges in the country, and I mentioned this resource guide, and I shared the guide, and they said, oh, we love this, we need this, we need to update this. And not long after that, we were awarded the Opioid Response Network, which I'm the principal investigator and the co-project director, working with a large coalition. So it's not just addiction psychiatry, because that's really not where people are going to come to get it, because the stigma of working with psychiatry and addiction, but really mainstream healthcare and other judges and corrections organizations working collaboratively. And so I wanted to update the resource guide and to also do some trainings around how to cultivate law and medicine partnerships. So through the Opioid Response Network, we took the earlier work that we had done at Brown University, and we've updated the resource guide. We did a 3-day training in Reno, Nevada at the National Judicial College with 45 champion judges who were tapped by their Chief Justice to come in and to represent their state and to really be the lead person to go back in their community and help share this information and resources. Now, let's keep in mind, we don't want the judges to be clinicians. That's not the goal here. But how can we, through the Opioid Response Network, put them in touch with local providers, not just physicians, but nurse practitioners and PAs and other health professionals that can work collaboratively with them to bring evidence-based practices? Because we all know when a judge wants to convene a group, people will come. And leading people in the community will look to a judge because they'll think that, oh, the legal part is taken care of, and now let's look at the medical aspects. So that's really been my primary involvement with the ORN and with judges. And that really excites me because judges really live and breathe this, kind of like the ED room. It's there every day. They don't have a choice. They're having to deal with it, and they see the continuous cycle of within families and generations of this happening. So there are other several opportunities within the Opioid Response Network where we're working with other branches, with the corrections, the prison system and jails as well, to build on opportunities for collaborating within the justice system.
Great, thank you so much for that, the background and the kind of lay of the land and how we got here. Would you have any advice for some of the kind of granular on the ground engagement strategies? What folks might be able to do to get started engaging judges?
I think the main thing is one is to do a little bit of homework. And I think get a sense of, and you can find out fairly easily who's involved in what types of projects. The chief judges throughout the country have actually come up with an opioid task force, and they have a guidebook that they came up with. And I worked collaboratively with them, and they collaborated with us on this. So we don't want to duplicate efforts. That's not the point here. But looking at the chief judge in your state and your community, reach out to them, say you're interested in being involved. What are some opportunities? I think the other thing is you can also submit a request through the Opioid Response Network, and that's probably the easiest way. And it's very efficient and doesn't cost you anything. It's free, and they can help guide you through the process. Who are some key leaders? I think one of the biggest things we've learned, I've been in this field for over 30 years, and what we found in the medical community is finding a champion. And I think once you find someone who really supports this and really wants to get behind it, it makes it much easier to, I call connecting the dots, identify other leading people in your community, to find a medical person, to find a community organizer, somebody from the prevention and recovery. And the Opioid Response Network can help do that. So we have technology specialists that can respond to a request. So probably I would go that direction first. They can do a lot of the background work to help identify people in groups to work with. And then once you do that, so you're not recreating the wheel, you can go around and find out what's already happening and then how you can fill a gap based on that.
Thank you, helpful advice. Do you have a few key challenges that you've faced and then some advice for overcoming those challenges based on what worked for you?
I think the biggest opportunity, but also challenge, is you're bringing people from very different worlds, and the vocabulary is very different. Language is different, and language is a really important thing that we all have to just be clear on from the get-go. Stigma is pervasive, not only in the general population, but within the justice system, throughout all of the justice system, but all through medicine. You have to understand, physicians and other health professionals are not educated on substance use disorder. They do not know it. And so that's a huge problem, is really getting them up to speed and taking ownership and being a part of addressing them as a part of the solution. So I think a lot of people in the justice system, people assume that since it's a medical problem, that the healthcare system understands it and the people. And you know, it's a lot of people still in this country will say, I don't want those patients in my clinic. So I think stigma is the first thing to overcome. If you don't overcome that, it's not going to change. And then I think being mindful and respectful of each other's worlds, because it does overlap both, but accepting that people deserve an opportunity for effective treatment and not just, you know, in and out in 20 days or 30 days and now you're fixed or you're not, but understand people have different pathways of getting there. Around opioids, having access to a medication is essential. You know, it's ideal if you can also have behavioral health as well, but because so many people have a co-occurring mental disorder. And mental health, I can't emphasize enough. People have to acknowledge it can be very complicated for a lot of people. And if you're also involved in the justice system and have a substance use problem, more than likely there's going to be a co-occurring mental disorder and other complicated life situations that have to be dealt with, and that you have to deal with those. You can't just ignore them. So I think being open-minded to that and understanding that it's really about connecting groups together. I think that's the biggest value of what I've learned. It's about coalitions in being respectful of what everybody's perspective, the recovery community, the prevention and the treatment, but also the patient's perspective or the client being the person in the justice center. So I think coalitions are really key. And I think the more we can work together, the more likely we are to make a huge difference.
Thank you for sharing that insight. You touched on a few lessons learned, namely the importance of identifying a champion. And then you just talked about building a coalition as well as addressing stigma and the importance of language throughout all of those paths. Are there any other key lessons learned you'd like to share with folks?
Well, it takes time. I think that's the other thing is people want, they want a magic pill. They want somebody to come in and just wave a wand or something and say, okay, fix this. It does take time. Their systems are really critical. I think that's the other thing is we spend a lot of time pounding on the health professional to do this, and not really looking at the full team. It's a multidisciplinary thing. And I think that's similar, taking that clinical approach into a healthcare setting or in a justice setting. Everybody needs to be on board. And so I think looking at systems and how to implement it is really critical. And we can't just accept and pass what we've done, and we kind of kept it off to the side. Okay, we'll do that over here, but it won't really be integrated into the everyday practice. And I think that's really critical. So it really is about systems, you know, who's going to be responsible for this and documenting and coming up with workflow. I think that's ultimately the biggest challenge is after you get through, you know, educating people about, you know, the stigma, talking, using the right language, but being respectful and mindful of each other's perspectives and where they're coming from. It's really about systems and how do we build systems and integrate it into what we're already doing and not separate it out. I think that's going to be key for real change.
Thank you. Thank you for sharing your experiences and making the time to chat with us today. We appreciate all the work you're doing in this space and look forward to engaging with you at the convening.
Thank you so much. I appreciate your taking the time to meet with me.